the doubtful pulse of the patient's lower extremity. While examining the artery of the following points are noted: pulse, While examining the artery, the following points are noted: pulse, its volume and tension, condition of the arterial wall, whether pulse, condition of the arterial wall, whether atheromatous or not, thrombosis of the vessels. When the artery is thrombosed, it fills midway between the firm and soft, and one can feel something within the artery. It must be remembered that in Buerger's disease, not only the distal arteries but also the veins are thrombosed. One should always compare with the pulsation of the same artery on the other side. In cervical rib and scalenus anticus syndrome, the two radial pulses are felt simultaneously after pulling both the arms downwards. This will cause a diminution or obliteration of the pulse on the affected side. Neurologic examination. Number 15. Neurologic examination. Sensation of the gangrenous area is often lost. The patient is unable to move the part when the viability of the deeper tissues become at stake. On the borderline of the gangrene, the skin becomes hyperesthetic. Sensation of the gangrenous area is often lost. Sensation lost. The patient is unable to move the part when the viability of the deeper tissue becomes at stake. On the borderline of the gangrenous, the skin becomes hyperesthetic. In case of superficial ulceration, one must exclude other disorder of the central nervous system. In case of superficial ulceration, one must exclude other disorders of the central nervous system. So, example: hemiplegia, transverse myelitis, syringomyelia, and Tape's dorsalis. In case of superficial ulceration, one must exclude other disorder of the central nervous system. Example: hemiplegia, then transverse myelitis, syringomyelia, Tape's dorsalis. Adson's test. Number 16. Adson's test. This test is positive in presence of cervical rib and scalenus anterior syndrome. This test is positive. This test is positive in presence of cervical rib and scalenus anterior syndrome. Scalenus anterior syndrome due to compression of the subclavian artery. Due to compression of subclavian artery. The patient sits on a stool. He is instructed to take a deep breath in and to turn the face to the affected side. The examiner examines his radial pulse, which is often obliterated due to compression of the subclavian artery. Now, examination of the lymph node. Finally, auscultation. Auscultation, inspection, palpation, no percussion, and auscultation. The importance of this examination cannot be over exaggerated. It is advisable to listen along the course of all major arteries. A systolic fluid over an artery is due to turbulent flow beyond stenosis. A systolic fluid over an artery is due to turbulent flow beyond stenosis. One should not exert too much pressure on the bale of the stethoscope, lest it should obliterate the artery and cause an artificial fluid. Systolic murmur can also be heard over an aneurysm. Systolic murmur can also be heard over an aneurysm. A fluid is also heard on the renal artery in case of hypertension due to renal artery stenosis. A continuous machinery murmur may be heard over an arteriovenous fistula. A continuous machinery murmur. Continuous machinery murmur may be heard over an arteriovenous fistula. Blood pressure of both the arms are measured to exclude affection of subclavian, brachiocephalic or axillary artery. Reactive hyperemia test is performed to know the severity of the arterial ischemia. This is done by inflating a sphygmomanometer cuff around the limb to 250 mm of mercury for 5 minutes. Reactive hyperemia test. Reactive hyperemia test is performed to know the severity of the arterial ischemia. This is done by inflating a sphygmomanometer cuff around the limb to 250 অর্ডার দেই। আচ্ছা ডিম নিয়ে এসো, ডিমের তরকারি সাথে একটা সবজি বা যা থাকে, ভর্তা নিয়ে এসো, ভর্তা মাছ ভর্তা, আলু ভর্তা যা থাকে। Then the 250 millimeter of mercury for 5 minutes. Then the cuff is deflated and the time of appearance of red flash. Then the cuff is deflated and the time of appearance of the red flash in the skin is noticed. It is 1 to 2 seconds in case of normal limb, and it will be 1 to 2 seconds in case of normal limb. And it will be delayed in case of arterial occlusive disease, and it may be It may never appear in case of severely ischemic limb. Severely ischemic limbs. The general examination. General examination. Atherosclerosis is generalized disease, and the patient must be examined thoroughly to exclude ischemic heart disease, cerebrovascular disease, hypertension, renal artery stenosis, etc. In embolic manifestation, the heart is examined for presence of heart is examined for presence of cardiac murmur, which may indicate certain lesion to cause embolus formation. Diabetes is often accompanied by atherosclerosis. Diabetic mellitus with atherosclerosis. Peptic ulceration is sometimes found to be accompanied with this disease, peptic ulceration.